the Blood Transfusion Service of Namibia, NAMBTS, held its Red Saturday blood donation campaign over the weekend. That is in Windhoek, Rehoboth, Swakopmund and Ongwediva. Now, the campaign was aimed at collecting over 200 units of blood to help maintain adequate supply levels during the Easter period under the national #Dare to Care initiative. Now, to share that is feedback on the event and outline the next steps, we are joined in studio by Manager for Marketing and Donor Relations at NAMBTS, Ms. Zita Tobin. A very good morning to you, Ms. Zita. Thank you so much for joining us.
No, thank you for the invitation. I really appreciate that.
It's a pleasure indeed. Hope you had a wonderful weekend.
We did.
Yeah.
The blood transfusion service, like you mentioned, were in 4 towns. We were in Rehoboth, in Windhoek, in Swakopmund, as well as in Ongwediva, with the aim to collect 200 units of blood. We fell short of that. We managed to collect 176 units of blood. But that's amazing, and we want to thank everybody for coming out, rolling up their sleeves and donating a pint of blood.
Absolutely. You chose 4 locations across the country to have this campaign running. Why did you choose those specific places, if you don't mind me asking you?
So we chose those 4 locations because we have branches in Swakopmund and Walfish Bay, as well as then in Oshakati and Ondangwa. And Windhoek then services the Rehoboth and Okahanya district.
Very well. Now, did you manage to, of course, meet you mentioned that you only met 170 of blood donations across the 4 towns. Which of the towns had the highest turnout?
Well, Windhoek would definitely have the highest, just based on the population and already the amount of donors that donate in the Commerce region. But I found it extremely beautiful to see that Oshakati or Ongwediva, they came out in numbers and performed extremely well. As a community, they stood together and came to donate.
Absolutely. We know that the NAMBTS is always trying to make sure that, of course, the public is well informed about the importance of donating blood. And, of course, they also understand why it's important for them to give blood and the importance of that. How would you describe the public's response and the engagement with the #Dare to Care campaign this time around here?
The response was very warming, and it showed the fact that Namibians always come up for each other. It's caring for your community and caring for, a patient that needs blood in the hospitals. So it's under the Dare to Care campaign, but it was called Red Saturday with the intention of filling up 200 bags of blood. And as I mentioned earlier, it's about caring for your community. That was the whole scope, because Easter, Friday as well as Saturday, there are numerous accidents on the road, and that's just one of the reasons we need blood for patients in hospital. Is if you've been in a motor vehicle accident, you will definitely need blood. But also because there are many patients in the hospital. You don't get sick because it's a public holiday. That doesn't matter. And like I said, it's important. It's very, very important for Namibians to come through and stand together during the peak periods, such as Easter as well as December and the New Year.
Very well. To your understanding, there is also a certain sort of stigma around people who are not donating blood. To NAMBTS's understanding, why don't people want to donate blood for the ones who didn't now?
Generally, the myth is that they're scared of needles. That is one of the biggest things.
I think I am too.
And the needle we use, it looks very big, but it's quite harmless. You really don't feel the needle being put into your arm. So that is one of the myths, and it's common that people want to get paid for donating blood, and unfortunately, we can't pay anybody for donating blood or any blood fluids for that. And the WHO, they are responsible and they regulate that. So in all countries, you may not pay somebody for any body part or body fluid. And to top that up also, it's against the law. So there is actually a bill in Parliament that says that the blood transfusion service, we may not pay anybody for donating blood.
Very well. Were there any challenges experienced from your team during the blood drive that they, of course, did over the weekend?
No, there were no challenges. I think it went smoothly. We fell short of the units that we require.
Yeah.
So we still just ask everybody during the next 4 days to come
Yeah.
and please donate blood. If you haven't donated blood in a long time, the criteria is simple. You need to be healthy on the day of donating blood. You must be older than 16 and younger than 65 if it's your first blood donation.
Right.
You must generally just feel really, really good and be committed to donating others, and of course lead a sexually safe lifestyle.
And one should not drink alcohol the day before, at least, right?
Yeah, you need to be well hydrated. So you shouldn't really be drinking the day before, or you shouldn't drink a lot on the day of donation.
Yeah.
But what is important is plenty of fluids. Yeah, and you must eat a meal.
Yeah.
Often people come to the clinic and they haven't eaten. And that's a reason for deferral. So you must have had a good breakfast or lunch, especially if it's your first time that you are donating. And on that point, it was really great to see that 25 people donated for the first time on Saturday. So we want to thank those people and join them to the blood donation family.
Absolutely.
Welcome them, yes.
Absolutely. Talk to us about, the next steps or upcoming campaigns for NAMBTS that the public should look out for, not only over the weekends, but even throughout the week. Especially now, we spoke about, this campaign is, of course, going to be helping, or rather collecting blood over Easter season and beyond.
Okay. So I'll answer that in twofold. First of all, we have blood donation clinics the whole week up until Thursday. Today, we're at our Tull Street Centre at 35 Tull Street. And we're in Swakopmund at our centre in Swakopmund, which is in Ferdinand Stich Street. We're also in Ondangwa. We're in Oshakati at the Oshakati Intermediate Hospital. And then tomorrow we're in Ondangwa and in Warfish Bay, as well as our headquarters in Tull Street. We have mobile clinics across the whole country also, so you can visit our social media pages and see where we are. And what I'd like to say is on Thursday, if you have time, we'll also be at Grove Mall, we'll be at Marua Mall, we'll be at Oshana Build It, as well as Ramos Realtors at the coast. So 4 days, come through, please. As a nation, we need you to come and donate blood.
Absolutely. Thank you so much, Ms. Tobin, for being here this morning, for such a great work that you're doing, of course, at the NAMBTS, collecting blood and saving lives. Thank you so much for being here. We wish you all the best. Yeah.
Thank you very much.
Absolutely.
We appreciate it.
Absolutely. Ms. Zita Tobin, she is the Marketing and Donor Relations at NAMBTS, talking to us about the Easter drive that obviously took place over the weekend under the hashtag Dare to Care initiative that took place in 4 towns, Windhoek, Rehoboth, Swakopmund, and Ongwediva. Also just urging the public that for those who are still thinking about donating blood, you can visit NAMBTS's social media platforms and you can find out in your locations the closest you can, of course, go to donate blood and save lives. It's for a good purpose, and of course it goes a long way in, of course, building our health and also saving those that are still needing the blood in the hospitals.